Hello, my name is Michael Mamuzelas, and I'm a student physical therapist assistant. And this is Anastasia, my model. She'll be helping me with my video today, where we'll be demonstrating a couple manual and massage techniques. Before I begin, we must first check with the patient with any contraindications. Um, Anastasia, have you had any recent injuries?
No.
No? Do we have any skin diseases or open wounds
No.
or sunburns we should be concerned about? Are you having any inflammations, or do you have history of varicose veins?
No.
No? Great. Okay. Next, we will explain to the patient the treatment using layman's terms. So what I'm going to be doing, Anastasia, is I'm going to be demonstrating a couple massage techniques. Some of them, we're going to start with the soft massage techniques, and we're going to go into the more firm massage techniques, and then we're going to finish off with traction for your neck. Okay? Do you have any questions before we begin?
No.
No? Okay, great. So first we begin by positioning the patient for comfort. So I have a couple pillows here, and I'll have Anastasia lay on her belly for me. Great. All right, and then we can put a pillow underneath her feet for comfort, and we can drape the patient for modesty. Okay. So next what I'll do is I'm just going to raise Anastasia's clothing up just a little bit, so the area that we want to work on is exposed and draped. So I have just a simple moisturizer that I'll be using to decrease the friction. Okay, tagamis. Okay, so now that the patient is positioned properly, we'll begin with demonstrating the C-stroke, or the effleurage technique. So the C-stroke and effleurage technique is usually a stroke that's used in the beginning of a massage. It's a C-stroke. Kind of almost cup your hand, and you're stroking towards the heart. You can do this with one hand or two hands. Use a light to medium amount of pressure and increase it through the end of each stroke. How's this pressure, Anastasia? Anastasia?
Good.
Is it not? It's not too hard, is it? Okay, so you want to make a slight pause and release at the end of the stroke. Make sure that you're maintaining skin contact going back, starting each stroke. So you just demonstrate this for a few minutes. We can see right here. Okay. So that is the effleurage, or the C-stroke. Second, I will demonstrate a kneading technique, or pesturage technique, followed by trigger point release. So with the pesturage, you want to use basic circular motions. Okay, and this is a slow circular motion in the area of tightness. The stroke should be applied 3 to 4 seconds per stroke. Working at the area that is most tight. The kneading or the pastillage is followed by the effleurage technique. Okay. You can use 2 thumbs for this, or 1 thumb, depending on your strength and the size of the patient and how tough the tissue is that you're massaging. Next, I want to go ahead and demonstrate a myofascial release. I'm going to demonstrate it on the upper traps here. I understand you're having some tightness up here, Anastasia?
No. Yeah.
Okay, so what we're going to do is we're going to apply significant amount of force to the area. So I'm just going to grab this upper trap here. Okay, and we're just going to keep that tight for about 60 to 90 seconds and feel that muscle release. Okay, and you want to brace the patient. This is going to hurt a little bit. You feel some contractions there. Good. Okay. And then you finish with an effleurage. So I demonstrated a C-stroke. I demonstrated the kneading and also a trigger point release. Next, what I want to do is demonstrate a deep friction massage. What I'll do is I'm going to demonstrate this on the patient's elbow. So these deep friction massages can be used for beginning stages of tendinitis. You want to make sure that the structure that you're applying this deep friction massage to is on stretch. So we're going to put this on her elbow. We're going to stretch her elbow. And what I'm going to do is I'm going 90 degrees to the target tissue. I'm using a slight arch of motion to target the tissue, and I apply it smoothly and steadily. And the goal for this is to cause some tissue breakdown. Great. And with this, you can also use 1 thumb or 2 thumbs, depending on your preference. Okay, all right. All right, next, lastly, what I want to do is I want to go ahead and demonstrate manual traction. And what I'll have is Anastasia lie on your back for me. Turn on your back for me, please. Okay. All right, come a little bit further down for me. Looks like Lucky's joined us for the video. So for traction, the first thing that you want to do is, I'm going to go ahead and get rid of this pillow for you, is we want to check first off that the patient has a intact alar ligament. Go ahead and relax your head. So what I'll do here is I'm going to palpate C2 to the occiput, and we're going to have the patient rotate our ligament disappears. So we're good. So with this traction, I'm going to position myself here and get a good grip. Depending on the size of the patient, you can use a hook grip or just cup the occipitals. Okay, we're just going to have the patient relax. Lucky, watch out, buddy. Watch out. Okay, go ahead and relax your neck. Relax your neck. Lucky, move, buddy. So you want to apply this force slowly and gradually apply the force. And we're going to do 30 seconds 4 times. You doing okay?
Yeah.
Can I pull a little harder?
Yeah.
Yeah? There you go. So you want to make this as easy as possible on the therapist. Use your body to pull and gently release. Okay. All right. A couple more times. All right, and the last one here.